So now let's come to the second part of the presentation, which is more focused on this software and more on its application. And everything starts with DICOM image data. So you load your DICOM image data, preferable computer tomography data. So it's only CE certified for computer tomography data. Okay. Then this data runs in the image segmentation. Image segmentation means you semi-automatically generate a three-dimensional model. Then this runs into the mesh generation that builds your finite element mesh. Then it comes to the structure analysis. That's the finite element simulation. Of course, the simulation requires blood pressure, gender, and other properties, and then predicts your stress and rupture risk. Then comes data analysis that extracts from all this information the most important determinants, so geometrical determinants and mechanical determinants. And then there's finally a reporting tool where the user can add some other information, and at the very end you get an analysis report as a PDF file which you then can communicate to others. Right, data management. So the software works remotely, so you can run it on a local terminal. However, it is recommended to integrate it into your VAX server. That means you can then download DICOM data from your VAX server, directly use this DICOM data and perform the analysis and store back your analysis report. So far it's only possible to store back the PDF, so the analysis report, and because there is no data format in the VAX system for our specific analysis. However, what is also on board on your local terminal is a database, which is very similar to a VAX database, where you locally have your patients and store all your information there. Right, that was data management. One of the most critical parts is the image segmentation, so we will see how that works later in the live demonstration. The software uses the concept of deformable bodies. So deformable body is something that inflates or deforms within your image data until it segments the body of interest. In this case it's the lumen, it segments the lumen, and that's the task of the image segmentation. The software uses pre-segmentation and final segmentation of the luminous surface, and then final segmentation of the exterior surface. In these steps a balloon model is used. What you see here, you can think on a balloon that inflates within your image data until it segments your body of interest. Of course it allows plenty of manual interactions, because image data is full of artifacts and you most likely have to manually interact somehow to get a reasonable reconstruction. Most important though is that it cuts off small vessels and always produces a smooth surface, which is very important in order to not ending up with stress artifacts in your finite element simulation later on. Now the finite element simulation or the structural analysis is very simple to apply. All what you have to do is you have, of course, to define your patient properties like arterial pressure, gender, and family history, and so forth. Then define the area within which you want to do the finite element simulation, and then perform the finite element simulation. Then comes data analysis and reporting. So a tool extracts the most important geometrical and mechanical determinants and puts this into an analysis report, as you see here. And important is that the mechanical parameters are related to the individual patient, are related to the average aneurysm patient, so you get a relative risk assessment.